Hey guys, welcome to today's episode of Surviving Grad, a juicy nursing series where we discuss all the things that they didn't teach you in nursing school so that you can feel more confident and prepared for your first year on the floor. I've seen a lot of students come through thinking that the way that you start a shift is to get handover, check your charts, do a planner, and then start some obs. Hate to break it to you, but there is a lot more to starting your shift than that. It's easy to get pulled in a million different directions at the beginning of your shift, tying up loose ends. All of a sudden you can be a couple of hours into your shift and one of your patients is suddenly really unstable. You're being asked why the last set of obs done on the previous nurse's shift, they were so unstable. You're being asked what was done about it, why it wasn't followed up, or perhaps there's no obs even put in from the previous shift. Another one of your patients is missing. You're being asked when you last saw them and you realize you don't even know what they look like because you haven't laid eyes on them. If this is you, don't worry, because this was me when I first started and I definitely found out the hard way by looking like a fool of what happens when you don't set your shift up properly. And there is so much that actually goes into setting yourself up for a successful shift. I don't want you guys to have to learn the hard way. You've done enough hard yards, so that's why today I'm going to teach you a foolproof method on how to set up your first and every shift for success to give you the confidence and peace of mind that you need when you're first starting out. So the way that I want you to look at the start of every shift is that you are going to be prepping for disaster, okay? Because disaster in the nursing world can strike at any time. You can get code blues, your patient can crash at any moment unexpectedly. So that is why I found this method that I'm going to teach you today, these checks, to be the most essential things that give you that peace of mind that if any of your patients crash, that you are ready to go, you're ready to jump into action. It's also just going to help you figure out if there's anything that the previous nurse has missed that you need to follow up on, and also to prepare yourself for handing over and leaving your shift. So without further ado, let's get into it. So yes, part of our check at the beginning of our shift is to check that the nurse that is handing over to us has done everything and signed everything correctly, because it is a bit difficult to check that with them if they've already left the building to go home. Starting off, our very first check that I want you to do at the start of each and every shift is a patient check. This is where you actually go to the bedside and you visualize your patient in their bed space, that they are also alive and breathing, okay? Very important. This is also a good time, if you've got a minute, to do your safety checks and make sure that oxygen and your suction are working correctly. If you do find yourself in an unexpected code blue and things aren't working, it is your responsibility. It reflects back on you not doing your safety checks. So please also make sure that these are working. After you have checked that all of your patients are alive and well at their bed spaces and chased up if any of the patients are missing with that nurse, perhaps they've gone downstairs or they're out with a family, or who knows, you just want to know where they are, and if they're not well or if they are found unresponsive, then that's when you've got the previous nurse there who can give you as much information as she knows, definitely more than you have just started your shift. So that's why it's key to do these checks. So after you've done this, you can now go in and check all of your charts as you normally would. If you're a hospital with physical charts, this is also a time where you want to make sure that the physical charts are actually there in front of you and that they're not missing. There's so many different places that they could be. If you've had to look for a missing chart, you know they can be with doctors, they can be at pharmacies, they can be anywhere. And it is the nurse's job who's handing over to you to make sure that you have that chart, or that she can at least tell you where it is. It is best practice to definitely have all of them there so that you can check all of the medication charts while the nurse who is handing over to you is still present, in case there's anything that is missing or unsigned or newly added. So really go through your chart and check if there's anything outstanding, if there's anything new that's been added. I also want you to have a quick glance and make a mental note if you've got anything due soon after handover or after the start of your shift. This is where a lot of medications get missed, especially from the morning shift to the afternoon shift. Those medications that are charted at say 4 o'clock can very easily get missed, and they're usually quite important as well. Warfarin and your anticoagulants can be charted at that time. The start of our shifts is a very busy period for us, running around tying up loose ends, so really just make sure, usually once you have checked the charts, this is where you go into handover. Ideally all of this is done at the bedside, but I'll touch on that in a second. You're going to receive handover and then you're going to start going through the documentation, and the very first thing that I want you to check is the patient's resus status. This should be at the front of the chart, so as you're working through the patient's chart, you're going to be going from top to bottom, so the resus status should be at the front. This is something that was drilled into me in my grad year. It was a ward with a lot of code blues and a lot of crashes, so I was always asked what the patient's code status was, what their last set of obs were, and I'm really glad that that was drilled into me so early. Just make sure that it is there, that it's appropriate, that it's recent, that it's up to date, and that it reflects the same resus status that you've got on your handover sheet. I personally write this down and highlight it next to the patient's name. If I'm using a separate planner, I will make it very clear what their resus status is. Don't rely on the handover sheet because it's not the official document. It can be input wrong, it can be outdated, it isn't necessarily something that is live. So check the resus status and make note of that somewhere. So very, very important. Then we want to check the last set of obs. This is to make sure that the patient is stable. If there's any observations that are out of normal limits, you can then ask the nurse there who took them about if there was any interventions, if the patient was symptomatic, if doctors were notified, etc. The other reason why you do this is sometimes the obs aren't actually put in, or they didn't copy over properly, and we just assume that there is a recent set in there. That isn't always the case, so that's why we check our obs as well before we go out and do anything. Another very important thing to do at the beginning of your shift is to check the doctor's notes and the doctor's plan. Don't just rely on the handover from the previous nurse that there is no outstanding tasks. The doctor's plan and note can be updated at any time, and the current nurse might not have been told or aware of any of these changes. So just make sure that you're checking the most recent doctor's plan. If there's anything outstanding there or any additional comments made, you can then ask that nurse if she's got started on any of those. If there's anything in the doctor's plan that is a bit confusing or ambiguous, you've also got the time, if it's say a morning shift or an afternoon shift or something that was recently charted, to question the doctor and have a conversation with them about it before they leave and go home. So that's another reason or another thing that you should do at the beginning of every shift. The next thing that I want you to do is go through all other relevant online documentation. These might be things like your neuro obs or fluid balance charts, skin assessments, bowel charts, bloods, any other mandatory things that you have to update within your shift. This might change from hospital to hospital, but there's usually different softwares and things that we have to use, so you just want to make sure that these things are all done. You want to make sure that any access devices such as central lines or intravenous cannulas are all charted and up to date as well. Next, you also want to do an inpatient check while the previous nurse that has just handed over to you is still there, checking things like surgical wounds to see if there's any strike through or surgical drains, indwelling catheters and anything like that, because if there's any abnormalities, you've got the time to ask the previous nurse if she was aware of it and how long it's been like that, and etc. I also like to keep my bed space tidy. I think that your patient's bed space is a reflection of you as a nurse, so I just like to do a quick tidy at the start of my shift and get rid of any rubbish, update patient boards and things like that. Ideally, all of this can be done with a bedside handover, but I know that bedside handover is not always done. Some nurses just don't like to do them. Some hospitals don't really practice them. Depending on what time of day it is or how busy the ward is, you're not always going to get a full bedside handover and the time to do a full check of all of these things with the previous nurse by your side to ask questions to. I'm going to be getting handover at the nursing station, and I encourage you to just quickly do these checks while the nurse is still here. It should just take you a few minutes, and if you notice anything out of the ordinary, you can quickly ask them or get in contact with them before they've left to go somewhere too far away. You can also use it whenever you receive a new patient, okay? And you've got to start from scratch and you're in the middle of a busy shift. That's where it's quite easy for us to skip over all of these things. We do a set of obs, and if they're stable, we can kind of forget about checking all of these other important things, which are really important in case they crash, okay? So also use it if you receive a new patient. All right, now guys, it's getting to the end of your shift and you're starting to change gears, starting to wind the shift down. Do you know what you're going to do? That's it. We're going to do the same thing all over again. We're going to jump into the shoes of the nurse that we're going to be handing over to, almost assessing us like we did for the previous nurse at the start of our shift. We're going to be assessing ourselves and make sure that we've done everything correctly, tying up our own loose ends. So we want to check our charts. We want to make sure that we have signed everything, that there hasn't been anything added to the medication charts that we weren't aware of. We also want to check the doctor's notes to make sure that we have followed up on any interventions, and also check if there's been any additional interventions or plans added by the doctor that we didn't see or weren't told about. This includes our own note, making sure that our own note is done. We are going to look at our online documentation, make sure that our cannulas are charted, that our fluid balance charts are updated, our neuro obs are done, skin assessments, you name it, whatever obs are a part of that patient's care plan, and any online duties or charting that you've got are complete. We want to check the latest set of obs to make sure that the patient that we're handing over to the next nurse is stable, and also make sure that they've been inputted correctly. A lot of the times, if we're using electronic systems, don't always have faith that they're going to copy over to the system. These things happen. So make sure that your last set of obs is in. We also want to do an in-person check to look at things like our catheters and our surgical wounds and devices, central lines and cannulas, making sure they're all okay. And even if your patient hasn't got any of those, you want to do the most important thing, which is check that your patient is in their bedside and that they are alive and well or breathing if you're handing over on a afternoon shift or a night shift while the patient is still sleeping. There is so much information that we need to input during our shift and keep track of. It's easy to miss something or to put it in incorrectly. Really thoroughly check all these things that I've mentioned today and assess yourself and make sure that everything is correct. It can be really dangerous and cause you some trouble, so don't underestimate the importance of doing this checklist at the end of your shift as well. If you've also got a few minutes spare, it doesn't hurt to tidy up the bed space again on your way out, the bed space and the nursing station. It just sets the next nurse up for a clean and organized shift as well, and it makes a big difference when you walk into a shift that is clean and organized compared to a messy, disorganized environment. Guys, these are the essential things that you can check at the start of every shift. It is hard because with shift changeover, you can feel the pressure to rush through everything and you want to thoroughly make sure that everything's done. But quite frankly, if we did that, we'd be there all day. So these are the most critical things that you can look out for and make note of and make sure that everything is in order. A lot of the time when we first start out nursing, we've got this constant anxiety that we are missing something, or what if something happens, and you're kind of stuck in this stressed out mode. So try that all out and let me know how you go and if it's helped you feel more calm and collected for your shift. And if you would like a printable checklist of everything that we've spoken about today that you can stick to the back of your lanyard or put in a little lanyard slip and take it to every shift, I will leave a link down below where you can download it from my Etsy shop for free. Guys, I really hope that today's episode has given you some confidence and eased any anxieties that you've got about your first few shifts. If you found it helpful, please let me know in the comments down below, and I'll see you next time.